Good morning.
Thank you for participating. You all have consistently participating with us each day. Would you all mind helping me give them a round of applause for doing that? Great, fantastic. You have a comment?
No.
Okay, all right, just checking. Well, let's move up the virtual highway of 50.
They're the only ones on.
No, Syson's not on?
They said they weren't.
Okay, Syson's not going to be on today.
And
Kansas City,
no.
St. Louis.
I'll try to call them.
I just spoke with the regional coordinator. She said there's some seniors they want to participate.
I'm
So
dialing
possibly.
them.
All right. Well, let's go ahead and get started today. You know how I like to go back and do a recap of what we did yesterday? So some of the things that I was looking at when I was reviewing the evaluations, I consistently saw when Dr. Grimes was speaking to you in regards to mindfulness was the breathing. So how many of you actually practiced that and thought about for your senses? I did this morning too, last night, because I knew, all right, this is going to be our last day. Go ahead and do your practicing of your breathing. So do we want to do that before we get started?
Yes.
Let's do it. Yeah, let's do it. You know, just sit up. Okay. Breathe in. And back through our nostrils. One more time. Mr. Flowers.
In Tai Chi, they tell us to breathe in through the nose and purse the lips and blow out through the mouth.
Well, that's a new tip.
That
too.
puts more tension on the diaphragm.
Thank you for that tip. Carruthersville. How does that feel?
It feels good.
All right. I thought so. Even when I was practicing that this morning. This feels really good. We're really concentrating on your engaging your senses. Let's continue on. It is my pleasure today to introduce to you our speaker, Dr. Dion Chavis. He's a graduate from Jefferson City High School in 1978. And began a 16-year trek at the University of Missouri, Columbia. While at MU, Dr. Chavis earned a bachelor's degree in biology, a master's degree in endocrinology, and the Doctor of Medicine degree. He also completed residencies in general surgery, plastic surgery, and microsurgery. For a while, Dr. Chavis and his mother, Dr. Edna Chavis, were students at MU simultaneously and would see each other on campus. Dr. Chavis moved his family to Indianapolis, Indiana in 1994 to establish his medical practice to this day. He has been in solo practice, private practice, since 1996. He also is the founder of Cara Spa, a medical spa located in Carmel, Indiana. He sold it in 2010 to focus more on his surgical practice and spend more time with his family. Dr. Chavis has one brother, John Chavis II, who is a Superior Court judge in Indianapolis.
Wow.
Dr. Chavis is an accomplished musician with a collection of over 25 guitars, several keyboards, and a drum set. He has been a member of numerous bands and has played events throughout the state. In the year 2000, to celebrate his 40th birthday, he took upon the hobby of mountain climbing. So far, his personal best is the 20,000-foot peak of Mount Kilimanjaro in Tanzania, which he summited in 2008. Please help me in welcoming Dr. Dion Chavis.
Thank you. My mother says hello. Yes. Thank you for having me. What we're going to talk about, thank you, that's an interesting introduction. I'm like, wow, I'm pretty busy. I forgot about that. I actually have 28 guitars now, but my wife put me on lockdown, so no more guitars. So I'm going to buy another organ. So, but what we want to discuss is skin care, skin anatomy, aging skin, how to not necessarily prevent aging, you can't prevent aging, but how to mitigate its effects. And since I'm a plastic surgeon, I've done trauma for 25 years, and I've seen everything 1,000 times. And so I've had to practice what I preach. Part of healthy skin is de-stressing. And so over the past few years, I've had to de-stress because, you got to walk it like you're talking. So I'm going to give us a brief anatomy lesson on skin, anatomy and physiology, not too heavy-handed. But I think if you understand the anatomy of the skin, you understand the aging process and what can be done to mitigate the process itself. So, first thing, we call it the integumentary system. It's the skin and hair and nails and oil glands, not just the skin itself. What's interesting, the skin is an organ. It is the largest organ of the human body. And what I find fascinating is that it's so important because we have what's called an endoskeleton. We're not like a turtle or a roach where they have a hard core shell. Our important stuff is on the inside. So our skin, the skin envelope, is what protects us from the external environment. And how it does that, or what it protects us from, first of all, mechanical damage. We know the daily bumps and bruises. I've seen motorcycle crashes and skin knees and those kind of things. That's important. Also, chemical damage. When you pour Lysol on your hand to keep from absorbing it, the body, the epidermis is sort of our external protector. It keeps us from absorbing chemicals. Thermal damage, not necessarily sun, UV, I'll get to that in a bit, but thermal damage meaning, just the other day I had in my clinic, one lady poured hot tea on her thigh, another young man grabbed some ramen noodles out of the microwave, and they had to come see the plastic surgeon. They'll be fine, but they violated their skin envelope, but they'll be fine. It's what we call a partial thickness injury, heals by itself. Bacteria, what's interesting about bacteria is that having done burns through the years, sometimes what ends up doing in a burn patient is infection. And infection does them in because the skin is a barrier to bacteria. When that barrier is broken, they end up getting respiratory infections. That's what it usually does in a burn patient, respiratory infection. The big key, though, is ultraviolet light, UV radiation, sun damage. Our skin protects our inner organs from the sun. The sun is wonderful, it makes the crops grow, but too much of a good thing can be a bad thing. And then desiccation, which means drying out. As we get older, we tend to be more dry because the skin isn't quite as robust as it once was. And then one thing the skin does do is it regulates our temperature, sweating. My wife lives in Rocheport. Well, she lives with me in Indianapolis, but we are in Rocheport. And I was jogging yesterday and running up the hill. Boy, was I regulating my temperature. I forgot how hot it gets in Missouri. I haven't been here about 20 years. And I was saying earlier today that back in the old days it had been messing up my Jerry curl, but it's not a problem now. The skin also is one of the 3 points of elimination of the body. There's the bowel, the bladder, and the skin itself. We eliminate toxins, we eliminate waste through the skin. So it's an amazing organ itself. And then vitamin D, which gives us bone strength, is synthesized within the skin. So it has to be, but vitamin D has to be activated by sunlight. So there has to be some sun in your life for you to be healthy, to have healthy bones. And once again, immunity. There's these cells in the skin called macrophages, which eat up debris. And once again, in a burn patient, when their skin is injured, those macrophages don't function, so they end up having trouble with immunity. And finally, sensory. Every part of your body has cutaneous nerves. And it's amazing the mesh of nerves. I do a lot of hand surgery, and sometimes people will slam their finger in a door. They can't believe how much it hurts. But I say, well, think about this. You can put your hand in your pocket, and you can tell a penny from a dime. Think about how many nerves that must be. And then when you slam them in the door, they're going to let you know that probably wasn't a good idea. So this, we're not going to go through every piece of skin anatomy here. What I want this slide to sort of tell us is two things I want to show here. One, the epidermis compared to the dermis. The epidermis is about maybe 20% of the entire thickness of the skin, but all we focus on in skin care and skin health is externally. You know, what kind of Lancome stuff am I going to put on my face? But if you see the dermis is the thickest, the dermis is where the blood supply is, then really what you put in your body is going to be more important than what you put on your body in the big picture. And then if you see between the epidermis and dermis, you see this, they call it the papillary area, that undulates up and down. That sort of breaks down with time, and that's how we end up getting wrinkles. So the structures are basically epidermis, dermis. Beneath that is something called hypodermis, which keeps the skin. There's a disease called Ehlers-Danlos syndrome, where you see the circus people, they can just pull their skin up like that or pull their skin out. They have the hypodermis violated by some sort of genetic mutation, so they can just pull their skin in all directions. But then beneath that is fat, what we call adipose tissue. So, structures of the skin, we have the epidermis and the dermis. The epidermis is essentially a leathery, waterproofing, dead layer. The outer layer is dead, the deep epidermis is alive. What's interesting in residency in plastic surgery, people always wonder when you have a laceration, they always want you to count the number of sutures. How many stitches did you give me? And I always jokingly say, well, I always stop counting after one. So you definitely have more than one. But some people think that the external stitches are what's going to determine the quality of the incision, the quality of the scar. But it's actually the dermis, because the dermis is where the blood supply is, where the action is. So we have the epidermis, we have the dermis. The hypodermis, as I said before, which is basically gristle, fascia, and then we have, which is sort of a structural component, anchors the skin to the muscle. That's why, you know, when your finger skin doesn't move back and forth unless you have, you know, a genetic condition. And it is a shock absorber. What's interesting is the 2 points on the body that absorb the most shock are the palms and the soles of the feet. So they are thicker and more resistant, and they tend to be, the dead layer tends to be leathery and thicker as well. And let's now, the epidermis. I'm going to show you the layers of the epidermis. There is what's called the keratinocytes. The keratinocytes are what we see. They are the external surface of our bodies. There is a fibrous protein. The whole body's made of protein. It's called collagen. We'll talk about that in a minute. And they start out as, I'll show you a slide in a minute, they start out as these little round cells and they slowly become flat. And what I find interesting about that is, I'll only tell you about melanocytes. That's our pigmentation. Melanocytes come from the epidermis, and melanin is not just dark pigment. Melanin goes from yellow to brown to black. There's numerous types of melanin, and here's the epidermis. I find this fascinating. I love my job, so I get excited. Wow, the epidermis. So I always say I paid attention in med school. So. What's interesting,
that means your patients are happy.
they appreciate it too. The reason I mention that is this is the epidermis. It goes from these sort of cube-shaped cells and slowly flattens. You see that the nucleus goes away, then it gets out to the sort of a dead layer. These are the keratinocytes. The reason I say that's important is because about 30 years ago when I was working on my master's degree, I did a study that showed that if you maintain the shape of the cell, you maintain the function of the cell, but as the cells flatten, they become less functional, which I find very interesting, that the less functional cells are the external epidermis. So what happens there essentially is that it's a leathery coating. It's our leathery coating.
Does it slough off? I mean,
It does.
Is it intentionally slough? I mean, the body sloughs it off.
Yes, and what's interesting about it is you don't realize every day you wash your hands, you're washing off some of that tissue. Like I broke my leg in '94, and I had this cast on. And you take the cast off, and it's full of skin, flaky skin. That skin would not have been there had I been showering normally. But once you isolate a structure, you don't have that normal friction. You're not rubbing your hands. You're not washing your hands, and it just sort of accumulates. So that lower layer is called the basal layer. That's the living layer, and they're what's called stem cells, which means that they are alive and they rapidly divide. Now, as we move out, they become less functional. They begin to create that protein called keratin, which is our leathery layer. they become flatter and flatter. These are the layers moving out. This is a dead layer. Then the final layer is the horny layer, the stratum corneum, which is our coating, essentially. Our protective coating is what we call that. Now, the dermis. This is where the action is. From here to here is what's going to determine how well someone ages or doesn't. And the dermis is made up of 2 layers. It's basically, this is going to be important too when we say the collagen is this fluid-filled matrix. Part of looking young, or part of looking healthy is going to be hydrated. That's why I'm glad everybody has their water. Diet Coke isn't a good form of hydration. Coffee really isn't, but some of us have to have our coffee, because I smell coffee. But mix in a water or 2 before you go home and everything will be fine. Beer's not terribly good, so. But the dermis is part of our hide, and but it contains our sensory fibers. It has the blood vessels. It has lymphatic channels. Lymphatic channels drain extra fluid back to the heart. It also has, that's where the hair follicles are, and our sweat glands and oil glands. Like I said before, part of immunity protection are these cells, these fibroblasts, macrophages, those kind of things. So the dermis has 2 layers. It has this papillary layer doing this, and it has a reticular layer, which is all the collagen down here. So this is where when you're young and you have doughy, beautiful skin, it's because there's plenty of collagen and plenty of fluid in the layer of the dermis. Yes, sir.
I have a question already.
Sure, go ahead.
Okay, I remember Lena Horne,
Beautiful. Ooh, that was my
and
girl.
she was, how old was she? when
In her
you-
90s. Mm-hmm.
Okay, but her skin looked
Mm-hmm.
like it did when she was 15.
Part of that is genetics. Part of that is genetics. Some of us have good
Different
genes,
effects.
some of us have good genes and some don't. Part of it is genetics, part of it is environment as well.
Okay, I'm going right now to Dr. Kassad. You probably have heard of him, because he had the skin.
Oh, sure, yeah, the
Okay.
skincare line, yeah. Mm-hmm.
Well, his skin is like Lena Horne, but it's dark.
Mm-hmm.
It's no wrinkles, or it's just as smooth as a baby's,
Mm-hmm.
And
Behind it.
I'm just looking at him, but a lot of people I see from that part of the world seem to have that gift.
Mm-hmm. Part of it is genetics, part of it is skin color as well. When I was in Tanzania,
Excuse me, Dr.
Yes, sir.
Chavis, we didn't understand what he was saying. Could you repeat it?
oh sure, he was asking about how some people tend to age better than others. Lena Horne, who was beautiful, through the end. Also, Audrey Hepburn was a beautiful woman to the end, and she never had any plastic surgery. A gentleman who is older and doesn't have any wrinkles. That's good. That's good. Part of it is genetic, and part of it is environmental. Like my mother, I won't tell you how old she is because I have to live with her in Indianapolis. But she's not young, but everyone mistakes her age for being about 20 or 30 years younger than she is. She's taken very good care of herself, but she also was blessed with those genes. So it's a mix. There isn't one, having owned a spa, and part of my de-stressing was I sold it so I could actually meet my 3rd child. Hey, nice meeting you. I missed the other 2 trying to be somebody, but part of owning the spa, I found that there isn't any specific magic potion. It's part of a program. Part of diet, healthy nutrition, de-stressing, and skincare as well. So I think that this gentleman probably has done the right thing. And part of it is genetics. Like I said, in Tanzania, there's women in their 80s, and all you could see was maybe a line here and nothing else. Part of it is genetics. Part of it is ethnicity too. So, so let's see. What am I doing wrong here?
No, I did it, I'm
Oh,
sorry.
okay, all right. Hey, she's leaving in Carruthersville. Call her back. So the papillary layer is that undulating layer which breaks down with time, and that's how we get wrinkles. They call them pegs. There's where the blood supply is. and where the sensation is as well. There's a receptor called Meissner's corpuscles. None of this is super important, but I'm just giving you sort of an overview of the skin itself. And these ridges allow, like I said before, when we put our hand in our pocket, that the skin doesn't rub back and forth across our fingers. It stays in place. It's basically scaffolding. Basically, the dermis is basically scaffolding. And this is kind of showing that papillary dermis again. That keeps the scaffolding in place. Now the deeper dermis, called the reticular dermis, that's where the structures like the collagen, there's another fiber called elastin, and I'll tell you more about those. That's where the connective tissue is. That's where the meat hits the bone, essentially. And that is what sort of breaks down as we age. Now this here shows us lines of tension in the skin. One thing as a plastic surgeon, to sort of camouflage a scar or an incision, you follow the lines of tension. And also, by following the lines of tension, you do less damage to the deeper structures, so things tend to heal. You're making an incision parallel to all these important supportive structures rather than perpendicular, so things tend to heal better. Let's see. Now, collagen. Collagen is a protein that makes up all of our organs. When I did my research in the 80s, there was 4. Now there's about 30 different types of collagen. But it is what maintains the water in our skin too. And if your skin is hydrated, the collagen is plump, and it gives you structure. That's why hydration is so important. Elastin is sort of this web that gives us support as well. Elastin fibers, I'll tell you, you can tell when they were disrupted. Stretch marks. Stretch marks are disrupted elastin fibers because the child has pushed elastins to the point where they tend to tear. And basically, stretch marks are tears in the skin, elastin fiber tears. One thing that I find interesting, those are some pretty bad stretch marks. Before, let's see. Oh, did that go back on the stove, or did I do that? Wow, I'm getting the hang of this, don't worry. I'm get my 9-year-old here to show me how to do it right. Part of the aging process, let's say in the aging phase, we'll keep it to the face. What happens is that as we lose the fat, as we lose the water and the collagen, as the elastin sort of attenuates, the structures of the face tend to move forward and down. But there's points on the facial skeleton that are static points where everything adheres to the bone. Those points are here by the sides of the eyes, along your smile lines, and in your jowls. So as your facial structure moves forward, the smile lines tend to be more prominent as we age. When we do facelifts, and I love plastic surgery, I love cosmetic surgery. Some of it, though, is a little overdone, and sometimes maybe you would look better had you got some facials, did a little sunscreen, rather than do the whole Joan Rivers thing, So, and I call that Beverly Hills plastic surgery because out there a facelift costs $30,000, and why have one done if everyone doesn't know about it, that kind of thing. So, I love my career, I love what I do, but sometimes beauty comes from within rather than on the operating room table. And don't tell my friends I told you that. That's our secret. Caruthersville is our secret. So. Let's see, now, I'm going to show you. Now, we'll talk about pigmentation, then we'll get to skin aging. Now, I love this picture because I've operated on someone who looks like everyone there, from someone who is clearly of African descent to someone who must have come from like Iceland or Ireland, and we all age, but we age differently. And because the primary cause of aging, I think, is UV light, then those of us that have the melanin protecting us from UV light have a different set of issues versus those that have very little melanin. And the young lady on the right, her issues would be fine lines, skin cancer. The lady on the bottom right, the lady on the left, her issues may be keloids, because the browner you are and more central you have a laceration or an incision, the greater the tendency to keloid because the dermis is thick. Having a thick dermis allows us to age with fewer wrinkles, but it also gives us higher incidence of keloid, of hypertrophic scarring. So there's a price to pay no matter what, So the pigments, everyone has heard of melanin. Melanin is brownish and also pinkish and red. It's from a cell called the melanocytes, which makes sense. It's down in the dermis. And what's interesting is that when you say you have a scuff or a burn in a person who has brown pigmentation, you can tell they're going to heal fine when you start to see brown polka dots You know, because if you know, I have a guy who just crashed his motorcycle, so he's all scuffed up, brown-skinned guy, but I see in his wounds brown polka dots, which means we're going to be okay, you know, and I don't get to operate on you, you know, and he's excited about that. But in the fair-skinned demographic, a freckle is basically an accumulation of melanin as well. And in that demographic, they have to watch out for skin cancer and watch for freckles changing. And once again, melanin is our shield from UV light. Now carotene, we don't talk about as much. Carotene gives us that yellow pigmentation that's more common in some of the Asian population, some of the Native American population, and some of the Kappa Alpha Psi guys, you know, that kind of thing, like my brother, but don't tell me. You know. And then once again, hemoglobin, if you have pink fingertips, it means that's blood running through your fingertips, that's hemoglobin. What's interesting is a couple imbalances, pigment imbalances. One is called cyanosis, which is when you're blue. People who have COPD that can't pass oxygen turn blue. When we talk about excessive sun exposure, I think of this lady recently named Tan Mom, who just has burnt herself to a crisp. And it reminds me of back in the 70s when I was at Mizzou, before I guess tanning, what's interesting about tanning has always been a sign of affluence. Because if you look at some of the paintings from the 1600s, the beautiful women were very pale. That's because it was pre-industrial revolution, and the unwashed masses worked in the fields, and the rich people stayed inside. So tanning was considered a faux pas in those days. But after the unwashed masses started working in the factories, then the affluent people could sit around the pool and get a tan. So since the early 20th century, a tan was considered a sign of affluence, which is interesting. What I found interesting back in the 60s, what's that?
I said, no.
You're rich, you're a rich man. But back in the 70s when it was still popular to tan, you know, and we know about melanoma in those days, but I know back at Mizzou, we would kind of crack up after spring break. We would see which sorority girl was the most burnt. And you know, you had to see girls with these big blue eyes and purple skin, and I guess, I guess it was cool, you know, but it sure looked painful to me, you know. In those days they would have these reflecting blankets and stuff. You basically was like putting a baked potato on the grill, you know, and luckily that's not as popular as it was, just for everyone's health, And so, and redness, another type of imbalance, is basically a sign of infection, and the pale skin is usually anemia or fear. Yellow skin is a sign of liver injury. What's interesting about bronzing, like John F. Kennedy had a disease called Addison's disease, which is a disease of the adrenal glands. And everyone thought he was very healthy and bronze, but it was a disease process which made him look so healthy, that bronze color, them bruises. So, and real quickly about the appendages of the skin. I'm not going to get into this too much, but we have two types of sweat glands. One is called eccrine, that allows us to regulate our temperature, and the other is called apocrine, which is sort of a musk gland, which is sort of the pheromone gland that isn't really activated until we get into puberty. And we have our oil glands. We all have oil. Some skin is more oily. And actually, oily skin actually looks less wrinkled than dry skin, and we all lose our oil as we get older, which is why we need to moisturize. And then one thing I find interesting about the nail is that, believe it or not, the fingernails add dexterity to your hands, because when you reach in your pocket, sometimes man, let me get that, you know, anybody got some nails? You know, I can't open this can, you know, that kind of thing. The fingernails actually add dexterity and function to the hand. They're not just ornaments, there is a function to them. So, all that being said, fingernails, I love fingernails. Now that we all understand completely the anatomy of the skin, what goes wrong as time goes on? Well, it's called oxidative stress. Oxidative stress is what causes the aging process. Oxidative stress is either from the environment or from intrinsic causes. And what that is we all know that oxygen is O2. But when oxygen goes into what's called a free radical, it becomes O3 minus. It has one extra little negative ion. And that oxygen wants to get rid of that ion and become regular oxygen again. And it will drop that ion off anywhere it can. And those negative ions damage tissue. They damage collagen, and they damage DNA too. What's interesting is that when those free radicals hit DNA, they cause, DNA is a loop, it's a perfect loop like this. And when the free radicals hit the DNA, it kinks it. And so DNA is essentially, it's a code, it's a translatable code. And then it starts incorrectly translating what it's supposed to do, which is how we end up getting cancer, because the DNA is being read wrong and producing the wrong proteins, the wrong tissues, that kind of thing. So the way we deal with oxidative stress with free radicals is what we call antioxidants. Now here are the sources of these free radicals. First of all, air pollution, environmental sources, air pollution, the sun damage, once again, which is the key, the alcohol, and one thing I'll say is that being healthy doesn't mean you have to become like a monk or anything. That no one more than me enjoys a New York strip and some, and some au gratin potatoes. You just can't have it all the time, that kind of thing. So sometimes people think that healthy living is punitive, but it doesn't necessarily have to be. I wouldn't smoke, don't mix in a cigarette every once in a while. I think that's a bad idea. But also stress. Stress does cause the aging process to speed up. It goes into bad sleep, it goes into always frowning, and you end up needing Botox. But stress management definitely is wise. In fact, I started doing meditation. I'll tell you about that in a few minutes. So what happens, how the skin breaks down. This slide is a little reversed because this is actually the epidermis here, and this is the dermis here. So what you're basically seeing is the dead layer is getting thicker. The epidermis, the live layer of the epidermis is thinning. We're losing our water in the dermis, and we're losing the subcutaneous tissue, the fat. And I'll give you an example. Someone who's losing fat in their face, and they're obviously aging is Al Sharpton. I've been watching him for years, and you can tell the aging process. He's losing fat in his face, and it's making him look older. There's no doubt about it. So, what to do? Having owned a spa, I think facials are important. I think that skincare is important. Being a surgeon, I think that sometimes surgery can help, but I always say beauty comes from within better than it comes from the operating room table. So what to do? Skincare is important, but it's confusing. Everybody has got the anti-aging thing that if you just buy this eye cream, you're going to look like Lena Horne, and it doesn't work. But getting on a skincare regimen, this is about being more proactive than reactive. One thing I found through the years is that the patients who do the best, I call them proactive participants in their care, not passive recipients. I did liposuction on a guy one time, and he said, doctor, you're a nice guy, but I think my body rejected your liposuction. And I was like, really? So it had nothing to do with the chicken wings and cheese fries, right? It was definitely me, because he wanted to go in, me do my thing and go back to that bad lifestyle, and wanted those results to last forever, and that's just not how it works. So here's some issues with lifestyle. And one thing I'll say that, like, my mom is my inspiration, because she and my dad had this lifestyle change about 1960, 1970. And we went from just a normal Brady Bunch type family with a normal diet. I had some relatives that smoked, came over for a scotch and soda. And then just one day, everything changed, and all of a sudden there was salmon and steamed vegetables and grapefruit juice, And my friends thought my parents had become like hippies or something, And they were exercising, my mom, And to this day, I don't think she's missed a day of exercise in 45 years, and it shows, So my point is, it's never too late to start doing the right thing, and it's okay to be healthy. It's not. What's the word I'm looking for? It's not punitive. You can get into good habits just as easy as you can get into bad habits, is what I'm trying to say. So here's what can make us age better. Exercising, what we eat. We're doing the breathing exercises. I recently took up transcendental meditation, which essentially 2 times a day for 20 minutes, you basically close your eyes and you put your brain into neutral. And my wife tells me, like, you just look better, you look more rested, And once again, hydrating, sleep. There's been a recent study that shows that that poor sleeping habits absolutely shorten your life expectancy, no doubt about it. And here's a person who's been sleep deprived, since the Reagan administration. So like I said, it's not too late to start doing the right thing. Limited sun exposure, sure. Limited, I think, is a good idea. And then, healthy bowels. Remember that the skin is the source of our elimination. So a healthy GI tract takes some of the stress off the skin. And, minimal alcohol, I won't do the drug thing. And happiness. What's interesting is that studies have shown that even in surgical cases, those people, not just cosmetic surgery, but in any kind of surgery, the people that come to you with an optimistic outlook always do better than those that are like, oh, woe is me. I don't know. Oh, it's gee willikers. If they come there like, okay, I want to get this taken care of. I can't wait to get back in the gym. I got to go visit my grandkids. Let's get her done. They tend to always do better than those that are like, oh man, I can't believe it. Me, gee willikers. So a positive outlook absolutely has a positive effect on how things will turn out for you. Okay, the things not to do, once again, smoking, stress, a lot of processed foods. You don't have to be a vegan, but you don't need Big Macs, candy, once again, sleep, the dark circles under the eyes. Mine just went away recently. As far as sun exposure, every time I've gone mountain climbing, I've been sunburned. And I once had freckles on my nose, and once I get sunburned and it peels away, the freckles are still there. I will have to watch my face for skin cancer down the road. But I'm not willing to not mountain climb just so I don't get a sunburn. You still have to live, And then once again, depression, I've absolutely seen affect skincare, affect healing, those kind of things. Now, as far as facials, once again, there's not any specific skincare line that I promote because I think some may be better than others, but none of them are as good as the person who wants you to buy, a $3,000 product. So the key is getting into a program or getting into a mindset where you get a facial once a month or every couple months, because the manipulation, the massage helps push some of the lymphatic swelling out of your face. The dermabrasion gets the dead cells that are accumulating on your skin off. And then usually estheticians are also in tune to diet, in tune to what healthy foods you need to maintain your results. So I think going to a spa, getting a facial, or at least getting a home facial kit or something, being a proactive participant rather than a passive recipient, and running to the plastic surgeon for a facelift. And then this one, I guess there'll be the printout with this one, which just shows you the products that can help you with your skincare. And then I think the final one is healthy eating. Sometimes people get a little too self-righteous about their diets, and go to Whole Foods and only have range-fed chicken, and all that stuff. Come on, man, get over yourself. But the thing is, in the end, what we consume will have an effect, because what we put in our bodies is very important. And like I said before, the whole saying, you are what you eat. You don't have to be a monk, you don't have to be a vegan, but you do need to kind of keep in mind fruits and vegetables are probably more important than, rib tip sandwich, to be honest, which makes me hungry. So that's pretty much everything in a nutshell. And I will answer any questions.
At this time, let's move to Carruthersville. Carruthersville, do you have any questions or comments?
Yes.
Yes, I do have a question. I noticed that often when they're demonstrating doing a facial massage, they have an individual that is lying down. If a person wants to do a home massage, is it just as effective if they're standing up, or would it be more effective if they lay down and do the massage themselves so the face can relax?
I think laying down, do you want me to repeat the question?
Yes, please.
Okay. The question was, is there any difference between the facial massage supine, sitting up, or laying down? And the answer is that if you're doing it yourself, laying down is most comfortable, but that's when someone else is doing it. If you're doing it yourself, whatever is most comfortable for you would be fine. I think just doing it is better than not doing it. And doing it in the mirror would be just adequate. When you go to the spa, laying down, having someone else perform the massage would probably be a bit better, but doing it at all is fine.
And one other question, I had watched a documentary and they were saying with so many individuals sitting in front of a desk, in front of a computer, but if they're holding their head, that they're finding more people that their faces are drooping underneath the area. Is there any suggestions that you can do to many people probably who are in the audience at this time who are daily they're in front of a computer and sitting at a desk to do some prevention from that?
The question was that those sitting in front of computers all day tend to become saggy. And what's interesting is that the face is a bunch of muscles just like the rest of the body, and sitting at a desk all day, everything else is going to atrophy as well. So there are facial muscular exercises, you know, smiling and those kind of things. And there, you know, you can get on the internet and find them, but just like any other muscle, the muscle will atrophy if it's not used. And so that, to me, that sounds like muscular atrophy. And if there's, you know, 10 minutes a day or 15 minutes a day, a muscular facial exercise, squinting and moving around, I think that would help.
Thank you.
You're welcome.
Are there any questions here?
Yes, sir.
So often you hear when you come out of the bathroom, you should sing happy birthday twice in order to get the proper amount of washing your hands.
Really? I had never heard that.
I think I heard it with Sanjay Gupta.
Oh, really?
On CNN. Mhm.
Oh,
That's what he does.
wash your hands and sing happy birthday twice.
Twice in order to get the proper amount of time to get them clean.
Really? I don't know, because the question was how long do you wash your hands to get them clean? Since I operate every day, I'm sure I do more than happy birthday, so, you know, I may be doing Brother Johnson or something, I don't know. But I don't really know, because I wash my hands so often all the way up to my elbows that I never heard it. Yes, ma'am.
I have a question. I have trouble with sagging. It's like one-sided sagging. And I've had different people to comment that it's best to exercise it like up towards your face. Then I've had others say, no, it goes like down toward your chest.
Mm-hmm.
So is there an appropriate way to exercise that, to try to, you know, move that and make it more firm?
Mm-hmm. Should I repeat the question?
Yes.
Okay. The question was on facial exercises, how to do them appropriately. I would say this. I would say that the line of tension, like we were talking about, in this part of the face is in this direction here. It's neither forward nor back. When we do a facelift, the facial skin is distracted up and back like that. So I think massaging is not going to tighten the skin because the elastin fibers have attenuated over time. I think that it may help with any kind of residual swelling and those kind of things, maybe some tone, but I don't think that massaging is going to really tighten the skin up. But if you do it in this direction here, because this is a swing right here, and so going in this direction is more anatomically correct, I guess.
Okay, thank you.
Yes, ma'am.
I know in college, we used to take an ironing board, of course much younger, so I can't do this now, and slant it, and then we would put our heads at the narrow point, or put our heads down and our feet up, and meditate. And since I no longer use the ironing board to do that, in working a lot and being on the computer, at work I used to just, put my head back sometimes and exercise my neck and meditate, and that really helped me a lot. So I just throw that out.
Sure.
Yeah.
The statement was about meditation, and I'm a big proponent of meditation. I have hypertension, and my mom has it too, and I went to, this part of the reason I sold the spa too, I went to, because even doctors, since we already know everything, we usually don't go to the doctor, So I went to the phone out there. Yeah, exactly. So I was having headaches, and this is about 2010, and my wife, demanded that I go see her primary care doctor. And I'm fine, And so I went anyway because she wouldn't leave me alone. And my blood pressure was about 210 over 110. So my head was about to blow up in a big mist. And she showed me my EKG. And I hadn't looked at the EKG since the 80s, but I looked at that EKG and I said, whoever that dude is, he's in trouble. Oh, that's mine? Oh, so right about then I sold my spa, and I couldn't quite get my blood pressure down as far as I wanted to. So I started transcendental meditation. I read about it on the internet. And TM does, if you do it, twice a day like you're supposed to, the relaxation does help your blood pressure go down. And it gives you this kind of positive sense of mind or sense of relaxation. So yes, I think that meditation periodically, just sort of like I said before, taking a minute or two just to put your brain in neutral, because there's so much stuff going on. I gotta pay the light bill. Man, I can't believe my son needs gas, that kind of thing. But eventually you just gotta sort of just like have a blank slate and just let your brain sort of relax, I think it's very effective. Yes, ma'am.
You mentioned keloids. Are there some lotions and creams that are better or worse for it?
Mm-hmm. Question was about keloids. Keloids are, what they are basically, they're a process of overhealing. There's a cell called the fibroblast, which makes the collagen. And in the brown skin demographic, the fibroblasts don't have, and many people, don't have the signal to stop healing. It's basically too aggressive healing. So what happens is that the collagen builds up, and then you have this mound. So it's more of a genetic thing. The only way to treat keloids is to excise them and then inject them with a steroid called triamcinolone. Because what you have to basically do is you have to get the fibroblasts to calm down and stop making so much collagen. So once a keloid is there, there's not going to be anything you can do topically to make it go away. But once you excise it and you inject the medication, there's something called a silicone sheet you put over it, and all those things together make the keloids less prominent. But once they're there, you have to deal with them surgically. So, yes, ma'am.
Are there certain vegetables or foods, well, I would say vegetables that you can eat to help keep the skin moisturized?
The question was about vegetables and moisturizing. Yes, I think that the big ones, carrots are good, lettuce is good, and what's the stuff from the guacamole?
Is it avocado?
Avocado, yes, avocado. Yes, those are good.
A lot of calories.
Yes, you got to go to the gym afterwards. But yes, those things do help. And the thing is being consistent with it, not like I have the prom, so I'm gonna eat a bunch of avocados. You have to be consistent. You have to be proactive. Yes, that's
okay.
true. Yes, sir.
I have two problems. Calluses on my feet. Thickening of the toenails and skin collecting under them, and brittle fingernails. And interestingly, I saw coconut oil and something else here that's good for skin care. So I'm wondering if there's something topically that I can put on my calluses to help smooth the skin, soften the skin. Yeah.
Usually those are all signs of dehydration. Brittle nails and calluses are dehydration. So yes, they're topical. Basically, the skin requires moisture, and anything that you can put on to moisturize, even vitamin E oil, something thick, vitamin E oil, cocoa butter, and over time it'll permeate and soften the dead layer up. Then you may want to have a podiatrist or something, trim things away. But I think that basically you're a bit dehydrated. That's what that's showing. So.
Did you say cocoa butter?
Cocoa butter or vitamin E oil, but something thick, something very thick. And almost put it on there and then put socks on, like at night, slather things up, put socks on, and then that gives it all night to have its effect.
Are there any questions from Carruthersville?
No questions. Thank you.
Thank you. Any more questions here? If not, please join me in a round of applause.
Good morning, Ms. Jenkins. We wanted to let you know from St. Louis, we are here. We were a bit late, but we are tuned in.
Well, thank you for attending. Do you have any questions for Dr. Chavis?
No, the one about the calluses and the brittle nails seemed to be of most interest. But no questions. Very good information.
Great. Any comments from any of the sites?
Very good.
All right, good.
I found this to be very, very enlightening. I really appreciate the information you gave.
Thank you
It
very
was
much.
excellent.
I hope that you have enjoyed the Paula G. Carter Center's first senior summer school. And it appears that probably this is something that we might need to continue. So thank you all for attending.
Yes, thank you.
And let's start with saying goodbye to our sites, starting with Carruthersville. Carruthersville, are you there?
Bye.
Goodbye, Carruthersville. Thank you for attending.
Thank you.
Thank
I
you.
enjoyed it.
Good. St. Louis. Goodbye, St. Louis. Thank you for attending. And thank you all, Jefferson and Columbia. We have some Columbia participants here as well. Thank you. Hope to see you all at NEMA. Please complete those evaluations.